Welcome to Learningkeda. Let us understand what is psychology. So, psychology is nothing but a scientific study of our mind and behavior. Okay, and it is given by American Psychological Association. So, usually in psychology, we follow APA, that is American Psychological Association. We follow APA dictionary. Okay, so psychology is nothing how we understand people's behavior and mind. Okay, so when we talk about psychology, there are two important terms that we need to know. First is the overt, and the second is the covert behavior. So now, what is overt? So when we say the word overt, it means it is something that is shown openly or it can be observed by other people. Okay? Whereas covert means something that is covered. As the name suggests, covert, that is something which we cannot see through our eyes. It is not visible to our eyes. So, overt behavior is something that is done or shown properly. So, these are the kind of behaviors or the actions that are usually observed by other people. Okay, so which includes our behavior, the way we behave, that is our facial expressions, then our gestures, our verbal expressions. So these are the things which we can easily observe. Some of the examples of overt behavior includes running, dancing, arguing, smiling, frowning, singing. So all these are overt behavior. Now let's talk about covert. So covert, it is something that is not visible through our eyes, and um, this it is also not observable by other people as well. Okay, so it includes our mental processes. Now, what is mental processes? Mental processes, which includes our thinking, decision making, reasoning, so judgment, all this would come under covert. Okay, so we cannot observe someone's decision making or thinking process, right? We can observe it through their actions, but thinking is something which we cannot observe. Okay, so some of the examples of covert behavior here includes our thinking, dreaming, glandular glandular responses, and etc. Okay, now, let's talk about the difference between a psychiatrist and a psychologist. So, when we say that you are a psychologist, people often get confused between these two terms. They will often refer to you as a psychiatrist, right? But there is a vast difference between these two. So, while a psychologist needs, the person can uh, do a bachelor degree in psychology or BSc, okay? Whereas a psychiatrist needs to have a MBBS degree. Okay, so the main difference between these two is that while a psychologist can give you a treatment or a therapy process, okay, whereas a psychiatrist is eligible to give you a prescribed medicine. Okay, this is one of the major difference between these two. That is, as psychologists we cannot prescribe medicine, we can only give treatment or therapy. So now, what is this therapy? When we say therapy or treatment, people usually think it is some kind of electric shock given to person, but it is not like that. Therapy, which also means talk therapy. Now, as the word suggests, talk, that means we treat people while giving counseling. Now, what is counseling? Counseling is a one on one process where there is a counselor and a counselee. So we give treatment through talk therapy. So now here treatment can be any form, like there are treatment processes which we will discuss further. So there is CBT, that is cognitive behavior therapy, where we treat people's cognition, that is our cognitive thinking, and their behavior. Okay, so these are kind of therapy that we use to treat people, that is CBT. Then there are some kind of psychoanalytic treatment. So there are various kind of treatments that we use while treating a patient. Okay, whereas a psychiatrist can prescribe you medicine. So As a psychologist, we deal with our emotions basically. Okay, whereas a psychiatrist works on the overall process. Okay, so let us see the differences again. So a psychiatrist can treat patients with medications, whereas a psychologist treat patients with talk therapy, that is through counseling. Okay, now a psychiatrist primarily deals with mental disorder, where primarily that means they primarily deal with it, whereas a psychologist's major focus is mental health only or mental disorder. Okay, whereas a psychiatrist can prescribe medicine, psychologist cannot prescribe medicine. Okay, a psychiatrist requires a medical degree, whereas a psychology doesn't need medical degree. Any bachelor's degree or BSc degree would like you need to start with BA, BSc, then comes masters as well. Okay, now a psychiatrist deals with complex psychological condition, that is depression. Okay, whereas a psychologist he needs to deal with, basically we deal with our behavioral and developmental issues. Okay, now we often hear this word stigma. Now what is stigma? Stigma is something which especially if we talk in accordance to mental health, so there is a lot of stigma prevailing around it. Okay, so when a person comes to you and say that he is suffering from any kind of disturbances, okay, or any kind of issue, now the other person will he will tell you that no, this is nothing that has to be worried. So it is, that is nothing sort of mental health, like you are just mad. So basically people used to treat you like that. That is because of the stigma prevailing, and especially in India, the stigma related to mental health is increasing a lot. So us as a psychologist, we need to aware people that as like mental health is as important as physical health. Okay, when you are sick, you used to go to doctor and you are okay. So now if you are suffering from any kind of emotional issues, that is, see, that is something which cannot be observed by people, and that's is hampering you a lot. Suppose you get a hurt, like you got a hurt, and then something happened to you. So people, it can be it's easily observable to people, right? So that's how they can help you. But when a person is suffering from any kind of mental disorder, he is not able to, other people cannot observe it, he is itself suffering from it. So now how do you overcome it? Go and seek help from a psychologist. Okay, now, stigma often comes from lack of understanding or fear. People usually fear that if I go to a and go seek help from a psychologist or a psychiatrist, people will think that I am mad. This is one of the foremost um, stigma related around it. Okay, because they fear and lack of understanding. Why? Because of lack of education. People are not aware of it. That is why they lack this understanding. Okay, so, inaccurate or misleading media representations of mental illness can contribute to both of these factors. Okay, stigma around mental health illness, especially an issue in some diverse racial and ethnic communities, can be a major barrier to people. Okay, for example, especially in India, people because of this stigma, people often avoid going or seeking help from a professional, whereas if you talk about other cultures or in other community like in US or anywhere outside, people are not hesitant to seek help from a psychologist. Okay, see, for example, in some Asian cultures, seeking professional help for mental illness may be counter to cultural values of strong family, social restraint, and avoiding shame. Okay. Now, as we have talked about stigma, let's see what is the harmful effects of stigma. It reduces hope for that person. It reduces hope, because of which a person is like helpless. Okay. Now he is so helpless that he will not know what to do next. Next is lower self-esteem. That is a value judgment of yourself. Okay. So it lowers the self-esteem of a person. then yes, if you are suffering from something and you are not seeking help, then it can lead to some other psychiatric symptoms. Okay, now next is the difficulties with social relationship. As you are not seeking help, as you're not sharing with other people, you will be isolating yourself from others, and that's how you will limit your social interactions. Okay, next, reduce likelihood of staying with treatment. So yes, you it will always reduce, like you will often tend to avoid seeking help from others, and then more difficulties at work, and that's how it will go on. Okay, so that is all about today. We will continue the rest in the next series. Thank you.